Welcome back for the third part of the series. I'm Rachel Manker, and today we're going to continue our conversation around the RACGP KISS standards and the privacy addendum. So welcome to the attendees. What we'll probably do today, as we did last week, is we'll move through our discussion and conversations, and we're pretty organised this week, so we believe we'll be able to unmute you and take some questions or have some sort of conversation at the end. And we hope it'll be enjoyable for you. Okay, let's have a revisit of the previous weeks. The aim of the series is to get an understanding and the importance of information security in the healthcare environment. We've been looking at the RACGP KISS standards, and we have covered so far. There are lots of kitty cats in these slides. So in webinar 1, Trish Williams took you through the compliance checklist, and she covered roles and responsibilities and risk management. One thing I didn't mention last week, but which is a fantastic tool on the RACGP website, is their digital toolkit. And when we come to talk about privacy later today, I might mention a few things that are available there. So in webinar 2, we covered the security policies, information backup, and physical security. So there were 5 matrices that we covered so far, and today we're going to cover another 3. But in essence, I think it's important to make note again that a lot of research has been done for general practices by the RACGP, and they've translated that research into a set of matrices. And the matrices, therefore, are a resource that general practices can rely on to assist them with what might be a relatively unfamiliar topic around information security. And as I mentioned last week, one of the great things about these matrices is that it allows the opportunity to have conversations within the practice and conversations with your IT support team. So even if we're looking at the Australian privacy principles today, there are some activities or security controls that you might need to do to enact the privacy principles, and the matrix gives you this opportunity to actually go to your IT support and have a conversation around what needs to be done. Because in reality, the matrices are completed as a team effort. It'll be the practice manager, it'll be IT support, it might be a practice owner or decision maker or someone else in the practice with a keen interest and knowledge around security. So again, it opens the opportunity for conversations within the practice. So by the end of today, we would have gone through 8 of the 13 matrices, and we hope, again, by going through them today, that we would have left you with the skill set to be able to complete the remaining 5 and the 8 we've covered for yourselves. And our intention today is definitely to set you up for success. So the 3 matrices we've chosen today around business continuity, securing health information, and Australian privacy principles, we feel are already matrices that you're doing and that you're already competent at. And by completing these 3 matrices, you would have the confidence to go on and complete the remainder and to seek the information you need to complete those matrices. Right, so hopefully everyone online and enrolled in the webinars took a look at the business continuity matrix, because there's 6 aspects to this. And again, business continuity around information security doesn't sit separately to business continuity within the practice. So if you were already looking at business continuity, you would already have taken a look at things like backup. So for the business if in an event that anything occurred, you would already have been considering a lot of these things. So you see business continuity covers things like, crisis communications, critical infrastructure protection, what's going to happen in an emergency, etc. Have we got incident reporting, disaster recovery? One of my favorite sort of analogies, I guess, is to imagine that you've got a big brown box, and in the event of something happening within the business, have we got everything in the box we need for the business to continue? And I suppose just a small part of that conversation sits around information and computer security as well. Right. So probably the best way to look at this matrice, and I hope you've managed to complete it and you feel pretty proud of being able to map where you're sitting at. So we'll just revisit how it actually works. On the left-hand side, you've actually got 6 tasks that you need to achieve, or activities, and you're looking to achieve them to a minimum of a level 4 standard, which is managed. So you're looking to be able to tick off down level 4 with the view of actually moving to level 5 optimized. So level 5 would be when you're really completing everything that needs to be done. So if you are mapping to a level 1, a level 2, or level 3, then the first time you map to this business continuity matrix would give you a baseline, and it would give you a measure of your performance. You can then have conversations around what you need to do to actually move to a higher level and aim to meet the minimum level 4 that you're looking for. So if we go through it, most practices have business continuity addressed within their practice handbook, and it's usually quite well covered. So we've got policy content, and the minimum, so that's 5.1, and the minimum standard you're looking for there is a complete written policy that you periodically review. So periodically should be considered annually in most cases, and that's what you've got at level 5. Then the communication of that policy, communicating it across the practice to people within the practice and the important aspects of that policy. So it's written, trainings provided to people in the team, people are aware what needs to be done, and that, of course, that policy is reviewed. You've got plans in place. You've thought through sort of critical business functions. You've defined your processes and you've fully documented them. You've got your additional resources that you need. So level 4 says you've identified additional resources, but they're not budgeted for. So you could use this matrix to go forward on 5.3 additional resources and possibly seek that additional financial resource that you would need to have additional requirements. And then you've got alternative procedures. So you've considered around the whole practice business continuity, what other procedures there are. Education, ongoing education of the team at meetings. So business continuity might just be a few minutes where you schedule that in your agenda just to address and update the team around one aspect of business continuity on an ongoing basis. And of course, do some sort of testing and planning around that, and recording of any faults and addressing, when you do those testing, you're addressing and looking at any of those faults. So the RACGP standard gives you some information, some explanatory notes around that, around business continuity. So practical implementation of business continuity and information recovery plans and critical elements of the computer and information security standards. So you have some compliance indicators there. When you've completed this matrix, you would keep that information in a file, I imagine, so that it was available to you at your next accreditation. And you would go to the compliance checklist and you would complete the compliance checklist at the front of the document, saying that you've gone through business continuity and you're compliant in that area. So again, for most practices, they would be quite mature in their business continuity planning. I've made a little note here around monitoring of information systems, and I've put that there predominantly because when I go out to practices and I ask them if their systems are monitored, in most cases, the practice manager might not know. So when one asks your IT support, and if you're paying by the hour, mostly what IT support would say, well, it's not an instruction I've been given to do. So again, that's the purpose of the matrices, is that built into the matrices would be monitoring as part of your network systems, for example. And monitoring might in some way be part of ensuring that the system is up and running, or might be considered a risk to the business. If that's not done, and it is fairly complex, so it's something you really want your IT support to manage and also to do the minimum amount that's required. So if you're monitoring a lot of logs, then you've got to check a lot of logs. So of course, that's a lot of time. So running efficiently in that area, but the KISS matrices gives you that opportunity to have that conversation and open it up, and to also be able to go to the decision makers around financial support and be able to say, well, the RACGP is the industry standard in this area of computer and information security, have supported the need for this, mainly around things like cyber security operations and those sorts of things, which we'll touch on in information sharing. And that gives you a tool, therefore, to go forward and possibly motivate the things that need to be done in order to complete the KISS matrices, in order to tick off the compliance checklists at the front, and therefore meet accreditation requirements. So what we'll do is we'll take a look at information sharing next. And in your work, I'm looking at my workbook. I've got a printout of the RACGP KISS standards. Security of information sharing of information within the practice is also well matured for practices. There's a few sort of technical terms in the standard around certificates and things like that. But again, that's something you'd be asking your IT support for. So the standard provides some explanatory notes. Securing electronic information is essential and requires higher security standards because you can prevent interception of information during transmission, prevent information going to unintended recipients, easier to disseminate or share electronic information. Therefore, once you've passed it on, you lose control of exactly where it goes after that. So sharing of information and control of that. You require better security measures around the protection of health information and the methods of communication. And of course, it may be difficult for you to detect that the information's accidentally been shared or been changed. So that explanatory note is there for you in the standard. And hopefully you're able to open up the standard, which is standard 12. And again, this is a very doable matrix for practices, and it's probably what you are already doing. So completing this matrix, which has got 5 activities down the side, by completing this matrices again, you can demonstrate a level of compliance. So what I wanted to do around the standard is, first of all, just talk a little bit about secure messaging. So again, you've actually got some of that information in the standard. Secure messaging looks at 2 types of messaging: electronic information transfer and email, and it looks at them separately. So secure message delivery has got encryption and authentication. So encryption is really scrambling the data such that it can't be intercepted and read. And authentication means you can verify who this information's from through electronic signatures. Now, most practices already know that what they need to do to meet the Australian standards, and would have this implemented for Medicare communications and other communications. And again, completely within your rights, you're having these conversations with your IT support around setting it up. So if we look at the standard, we start off again down the left-hand column with policy content, the communication of the policy, secure messaging, as I've just mentioned, healthcare identifiers, and practice website safety and security. So in this standard, it's also a minimum 4 that practices need to meet to be compliant. Again, you would go through the matrix and map where you are performing at. If it's below level 4, you could make a plan within the next month, 2 or 3 months, to actually address that. So is it around resourcing? Is it around PD, etc., in order to move you to level 4 compliance? I think one thing we have mentioned before is definitely worth mentioning now is whilst there's 13 matrices, if one just attempts one at a time and even aims for one a month, theoretically, if you were going to complete all matrices annually, each matrices that you complete improves your security. So I think it's about breaking the task down and saying, well, if we've done 3 of the 13 from today, or we're scheduled to do them in the near future, you have demonstrated improving protection of that healthcare information. And that's really what it's about. It's about incremental and sustainable improvement of security practice. So planning ahead. So policy content, you've got a written policy around it. It's periodically reviewed. So again, the optimum level 5 would be that you were doing that annually. You're communicating that policy in a written format. You're providing training to all practice team members, and the team have access to the policy when they want to look up information. Secure messaging, so 12.3. All certificates are stored securely, and the expiry dates are recorded. Again, you're having conversations with IT possibly around that. Healthcare identifiers, training and the use of health identifiers is undertaken as required. And your practice website safety and security. The website is hosted externally or on a separate server or practice data, and not accessible directly through the practice network. So that's something you'd be seeking your IT support to answer for you, having a conversation with them there. And as we go into looking at things around safety and security of the website, then that leads us naturally into the privacy principles, which we're looking to discuss next. So I might give you a moment. The Addendum 13, the privacy principles, is not in the workbook, so you can download that off the RACGP website. This one is fairly sizable and, of course, exceptionally important. So just to revisit, the Australian privacy laws were amended or changed, updated in March 2014. Now, most practices that I speak to or have spoken to, at the time, a lot of insurance companies went out, with legal teams and were providing seminars. So we find that practices are actually quite mature in their understanding around the privacy principles. I'm just going to revisit a few concepts just to bring us in line here. And then I'm going to note that at the back of the KISS standards is a list of legislation that practices need to meet. So if a practice is unsure, this information is provided for you by the RACGP. So privacy relates to the management and protection of an individual's personal information. And for general practices, it's really important in ensuring that the privacy of a patient's personal information is protected and secure. So general practices need to comply with privacy legislation to ensure that patient information remains private. So what the RACGP have done in creating the Addendum 1, the compliance indicators for the Australian privacy principles, is they have done the work around reading and understanding the APP legislation and putting the required, what practices need to meet into this matrix. So a lot of that work's done. If you need more information or explanation in how the detail of that, of the legislation, then that is available just by Googling the Australian privacy principles. There's some great information flyers put out by the government. So improving patient safety through applying effective privacy policies and principles is to ensure that the practice is compliant with those privacy laws. And the best way for us to actually look at them is to have a look at the matrix. So the matrices, there's 13 areas to the Australian privacy principles, or the APPs, and the matrice has detailed what practices need to do. So following the same logic, down the left-hand side, you've got the compliance indicators and you've got the APPs which that maps to. So we've got personal information privacy and we've got level 3 defined as the minimum level here. So last week and possibly in the first week of the seminar, we mentioned that I think there's 8 of the 12 standards where level 4 is the minimum standard, and 4 of them, and plus the addendum one, the privacy one, is a level 3 standard. So a decision made by the RACGP that practices are compliant with that minimum level. Again, nothing stopping you from aiming to map to a level 4 or level 5, a higher level of compliance. But what we'll do is we'll look again at the level 3 minimum standards, and practices can map how they are performing against those. Now, I did have a conversation with an IT support guy who was fully employed by general practice, a large general practice, and he'd said to me that the practice manager had given him this addendum one and had asked him to complete it. And of course, he couldn't. There was a lot in here that he couldn't complete. So again, as with all the other KISS matrices, it's about having a conversation between the practice manager and IT support in completing these and having the conversation around them. So have reasonable steps been taken? So the practice has documented and implemented procedures to meet the APPs. So for practices, if they're unsure of legislation and the APPs, additional references are available on that. One of the things I did actually, which I mentioned at the start of this webinar, is the RACGP have developed a digital business kit, which has got a lot of information around this addendum one, the APP's Australian Privacy Principles. So a good resource as well if you need further explanation or information around what's happening. So again, we're looking at privacy content. The practice has a written APP privacy policy that includes the content that is specified. The policy is available publicly. However, the practice's privacy policy doesn't need to be made publicly, but the APP, as it impacts that. The APP privacy policy is accessible on the practice website or in a printed format. So one of the conversations you may need to have is to give ownership to IT support for ensuring that that is available on the website. Perhaps the practice manager checks that it's there, but actually someone has ownership for ensuring that that's done and it's up to date if it's amended. Process for privacy inquiries or complaints. The practice has a written procedure for handling inquiries and complaints, which is what the legislation allows for. And in this way, we work through the matrix. So we've moved to number 2 now. We're working through each of these parts of the privacy principle. I'm not sure I need to go through all of them for you, but so you're following the left-hand side, you're ensuring that you're actually systematically working your way through the matrix. You're mapping the standard at which you're performing to. And by doing each of those things, you're able to demonstrate that you have covered off on best practice so that this information security or this privacy addendum is available to you. So let me move through my slides. This is not what we're looking for. That's the sample of the matrice which was emailed out to you, so I hope you're looking at that. There's the fact sheet I was referring to, so available online, very helpful, very short and concise. And this is really where I was heading to, that we take each standard one at a time, you benchmark how you're performing, you have the conversations at the pace at which the practice can handle that. And you're having discussions around security within the practice and feeling a level of confidence and success as you meet each of these minimum levels for each of the matrices. So protection versus access, and that security is not your core business. You have resources and support that practices have around that from their IT. You can ask for additional resources if you need them. So I think instead of going through the whole APP matrices, what I might actually do is have a look if anybody's got any particular questions around that or if they've actually done any of that. So I'm going to unmute you. Give us one moment. I'm unmuting you now manually. Okay, there's 5 attendees online. Does anybody have any questions? Or you can type your questions. Did anybody online, how did you go with completing the business continuity matrices? Is there any questions around that? Now, I've got the webinar recording just while we're waiting, but are there any questions from anyone online? Is this seeming doable? Has it been helpful to work through these matrices with you? Katie, are you there? Oh, she hasn't got a mark yet. No worries. I was going to ask you how you were going. I'm just going to have a quick word. I'll be 1 second. Just stay online.
I'm on a roll. You're on a roll. Winning enough each week to reimburse for the next week. I started my weekly pay numbers. I'm going around. Cool. Yeah. The millions coming. Is he on the phone heavy?
No webinar.
Hello. I'm back. Are there any questions at all? Okay, so what I'll do is I don't have any questions typed either. What I'm going to do is just reiterate that resources are out there for you on the RSCGP website, Rural Health. You're welcome to email through any questions. So if you find yourself going through these matrices in the next few weeks and you've got a question, to email that through to Rural Health. We're very happy to address that for you. And enjoy going through them and being compliant.
I do want it sent there, but...
Thank you for listening.